Hello, this is Dr. Eric Potter, Functional MD from Sanctuary Functional Medicine. We are here again for a Facebook Live talking about mold and its effects on our health, particularly our mental health is going to be the main focus today. If you are online and can hear me, just do let me know so I can adjust volume or anything else if that's necessary. I see a few are coming online, so I will keep doing a little introductory talk for a second. But again, mold and mental health, we're going to be doing some education, answering a number of questions about mold and mental health and just mold in general. Some of the questions that have come in on Facebook or through email, through the website. We appreciate those to give us a head start on things. But we also want to just focus down on how those two are connected. How does mold affect how we feel, how we think, how we are able to relate to others, because that is a major part of this illness in the fact that it's very dehumanizing. As I said, it's education. I'm not going to be able to diagnose or treat online. If you're already one of our patients, we have a portal where you can send us that information and we'll be glad to try to answer it. But if you're not, we're also glad to help you with those issues if you do find out you have mold or you think you might have mold. So let's get started with just a 10-15 minutes or more of talking about how the two are connected. So first of all, what is mold toxicity? Let's just give everybody a background. I've talked about this before, but I want to make sure we're starting at the same point. So mold toxicity means that there are toxins produced by mold that are building up, typically in an indoor building, not necessarily outdoor because the wind blows them away, more in an indoor building. We breathe those in. We call those biotoxins. They're made by another organism. And with that, we get into our bodies. Some patients are not able to clear those. Their bodies do not clear those out. They build up, set off a chronic inflammatory response syndrome. And what happens is the alarm bells start going off. Our immune system, our hormonal system, our neurologic system starts getting fried. And that has some effects on the mental health that we'll talk about in a moment. But with that, it's kind of like a snowball rolling down the hill. Once it starts building up steam, it takes a life of its own, and you don't have to push it anymore. So those toxins keep triggering that same reaction. So with that, we have numerous effects. We call it a multi-symptom, multi-system disease, in which the symptoms can cross in the skin, brain, again, mental health, our GI tract, our endocrine system, our hormones, into our respiratory system, sinus, allergy system, so our pain system, so how we perceive pain or our joints, our musculoskeletal, our energy cycle. So many systems are affected. It typically lasts for months. This is not something you get over the symptoms in a week or two. So with that in mind, then how does it play a part in mental health? Well, you can already imagine someone who is having that many symptoms that don't really have a good explanation by conventional medicine, and they're having it for months and months, possibly seeing multiple doctors. We have patients who say, oh, you're doctor number 21 or you're doctor number 17, and they've not gotten answers, so they keep trying, but it can be pretty frustrating for them if you've been to that many doctors without answers. But they come in, just that amount of stress can make you kind of depressed, can make you anxious, it can make you doubt that you're going to get future answers or ever get better from this illness. Also, as you're diagnosed, there's a lot of fear because you become fearful the next time you might get exposed to mold. What if the next building, if you go to visit in-laws, if you take a new job, is there going to be mold? Do you go to a store and buy clothes and only to find out there's mold spores and mold on those clothes and you can't wear them or have to wash them before you do? So there's a lot of fear just inherent in the whole thing in the first place, and a lot of depression, a lot of emotions get stirred up. However, mold does a lot more than just trigger those things because of circumstances. So that's what we want to talk about today. So mold, easy way to put it, if you've watched the little videos that are leading up, 30 seconds to a minute that we do in the week leading up to this talk, it talks about, so say for Anxiety. It may be that your neurotransmitters are imbalanced. It may be your hormones are imbalanced. It could be with depression. Also, your energy cycle can affect your emotions. Your energy hormones can definitely trigger emotion. Inflammation can cause depression symptoms if it's chronic in the brain. So it comes at it from a whole lot of different directions. And I talk about those in different situations. But let's just talk about, step back and look at each system that impacts our mental health when we're dealing with mold. So first of all, neurologic system. That's kind of obvious. That's our emotions are set into our brain, our mind and spirit working through our brain. So with that, our neurologic system, if it has inflammation, will be affected, such that you won't think as clearly, you won't be able to reason as well. That makes you potentially a little more fearful, or you might be more depressed because you're realizing you're not remembering things as well as you used to. It can also, besides disrupting memory, neurologic system, you can have more pain, or just the fact dysfunction in a certain area of brain that normally helps with moods may be imbalanced, and then your neurotransmitters, you're having either more norepinephrine and epinephrine that might be triggering some anxiety, or you may have lower levels of serotonin, so you're not having as many good moods. Dopamine, you might not, low levels of dopamine might mean you don't enjoy things as well. On the other side, high levels of dopamine may mean that you have some schizophrenic or kind of paranoia type symptoms, which often happens with mold. So your neurologic system can definitely play a part. Then we step back and look at your immune system. We already talked about inflammation. Inflammation can cause damage to the brain, cause some of the things I just talked about that are neurologically based, but that chronic inflammation, depression and anxiety may be some ongoing inflammatory states in a number of people, not just for mold toxicity, but for other types of depression as well. And you can also see that contributing to things like Alzheimer's or other neurodegenerative diseases where there's other types of symptoms besides just the mental health. So with that, you've got an immune system that's stirring up things. The immune system also, for example, there's your serotonin pathway. You need tryptophan to make your serotonin. With that, when there's immune upregulation, you start going down the IDO pathway to make kynurenine, kynurenic acid, potentially quinolinic acid. The kynurenine is actually helpful in trying to turn down inflammation. If it gets turned into quinolinic acid, it can be inflammatory and actually neurostimulating, can have some negative effects. However, the bigger thing is it's all stealing tryptophan that can't then be used for serotonin. So there's a lot of theorizing in science whether or not that one of the reasons when people have an illness like a flu or a bad infection, stealing some of that tryptophan and turning down your production of serotonin is why people feel a little depressed, a little sad. You know, being sick is frustrating, but that there may be a chemical imbalance that happens with mold patients. If that, if you got a flu and it goes away in a week, you're feeling better. You got a mono, maybe lasts a few weeks in some cases and goes away. However, if you've got something that lasts for months and you keep having trouble with your serotonin being too low, you are going to be depressed. So the immune system is having an effect there. Also, the immune system suppression allowing other infections. So if it allows yeast to build up in your gut, and then you are also having even more effects from sugar cravings. If you don't eat the sugar, yeast release chemicals that make you crave or make you depressed until you have that sugar again. So they can definitely, and then when you eat sugar, feeding the yeast, they release chemicals that release serotonin, for example, and you may get a little manic. So a lot of those mood swings could be whether or not you're eating sugar because your immune system's suppressed, allowing yeast because it's suppressed by mold toxicity. Or also Lyme can do that as well because it is also producing biotoxins. So then step back to say your hormone system. So obviously there's a lot going on with progesterone being low prior to ladies' cycle, monthly cycle, can cause low serotonin. So if you are decreasing the amount of hormones you're making because of mold toxicity, and that's one of the things that happens, what you can see is they're going to have worse cycles, worse PMS, premenstrual syndrome. They can even go to premenstrual dysphoric disorder, where it's a much more severe depression, not just moody, but more severe depression, even to the point of suicide, or thinking about hurting themselves. So progesterone being lower, lower hormones. You can also have fluctuation in hormones. Low levels of testosterone are common with mold toxicity, such that you be depressed, and this is both for guys and gals. In terms of not having as much hormones means you're going to be a little tired, a little more depressed, and those fluctuations or just chronically low levels can be an issue. And also your progesterone impacts on how much serotonin you can make, so that augments that fact. Immune system lowering your serotonin production, progesterone deficiency causing some lower serotonin, so you have some negative effects there. So far we've looked at the brain, neurologic system, we've looked at the immune system, and we've looked at hormones. Now your gut, like how does the gut affect our mental health? Well, there's a lot of research out there now in the microbiome world, especially looking at the bacteria in our gut can affect our mood. Those bacteria can make either serotonin or some of the neurotransmitters. Some of those then interact with our nervous system in our gut to send message to the brain that we can actually have some mood changes, anxiety, depression, and there are some studies that are showing that certain probiotics can have an effect, beneficial effect, or also some bacteria that can have a negative effect on our mental health. So if you have mold that sometimes has some effect on the gut, causing dysbiosis, dysbiosis means either too few good bacteria or too many bad bacteria, and also mold can cause some leaky gut and damaging the gut barrier so that more chemicals more proteins are getting through into your bloodstream. That can have an effect, but it can also, like I said, just have released chemicals that are interacting directly with your nervous system. Some would call our gut our second brain in terms of how much serotonin is actually more there than it is in our brain itself. So you've got the gut as being another potential interaction. Another thing with the immune system I forgot to mention was mast cells. You can have mast cell activation disorder. Now, a lot of that can be allergies, sinus symptoms, hives, rashes, GI symptoms, but it can also trigger migraines, and it can also trigger what we call histodelia, meaning some little euphoria or even a little paranoia from getting too much histamine and getting overstimulated, so that can have some effects on mental health. Now, one of the things in the little preview videos I talked about is you can have some pretty serious mood swings. So mood swings being that you feel like, as we joke here in Tennessee, that the mood, if you don't like the weather, it's going to change. Just wait 5 minutes. Often that's the moods for patients that have mold toxicity. They feel like the spouses or family members or friends will be like, their moods can go from one end to the other and back and forth in a very short time. Well, all those systems we talked about, if you've got the neurotransmitters pushing this way, then all of a sudden the hormones push this way, and then there's a surge in the limbic system, which is part of our fight or flight response in our brain, controls when you're scared. Those things can throw someone all over the map. And on top of that, they're just feeling bad. When you're mold toxicity, you've got multiple symptoms, multiple systems, you're feeling pretty bad. So with all that in mind, they can have a lot of mood fluctuations, and family members, again, spouses, can get very frustrated. But like I told someone earlier this week, looked at the husband, and I like it when the husband or the spouse comes in and I can talk to them and say, listen, your spouse, yes, there's days when they don't make sense because they feel so bad and you can't get through to their emotions. You're like, you can be logical, but they're not going to understand it because they're so worn out by the mold toxicity and so affected by it. That's not your spouse. That is a mold, and we're going to get through that, and we're going to walk you through that, and that does get better. Sometimes that takes a little bit longer, which mold toxicity often takes months, sometimes even a year or two to see really true full recovery from that. So not to get discouraged. Now, that's a lot of nitty-gritty before we go to questions, but I do want to step back and talk about, I want to take a few minutes to talk about the big picture of what mold does to someone. We've talked about the science, the details. Let's talk about the big picture of just a good framework how to view the effects of mold on mental health. I think a good way, and this is what I like to do when patients are in clinic, is put things down to simple terms that's easy to remember and make sense. So think about mold, what it does to your emotions. It takes kind of the bad side of your emotions, whether you have a tendency to be a little anxious, tendency to be a little depressed, a tendency to be a little hyper, a tendency to be forgetful. It augments that in most of the time. So if someone has a little kind of leans towards, because of their life circumstances, they're a little more anxious. It makes them much more anxious. So it turns up the bad side, the negative side of their personality or their nature. Now, in other cases, sometimes people will have completely flipped, where they normally are very calm and they become very hyper and anxious. Other people are really normally a go-getter, the Energizer bunny, that all of a sudden becomes the moping person who just moves slow and doesn't move very fast and just thinks slow. So it can do the opposite, but usually it's always in a sense that it's dehumanizing. So it makes a person less human. And what I mean by that is your ability to think, your ability to feel rightly, to feel emotions towards a situation that are appropriate. You may cry at, we can joke about crying at the drop of a hat on some sad movie. Guys and girls can disagree on what is appropriate to be upset in watching a movie, but these are things where people are like, I don't know why I'm so upset. It's not really a big deal, but the slightest little thing can tip me over and cause me just to go into a panic. So it's those things where you're not able to think rightly, feel rightly, but you're also, the other difficulty is the family members, friends, or spouses, or even pastors, or coworkers are trying to say, oh, you really don't need to be that worried. And that person may say, I agree, it doesn't make sense, but I still am that worried about it. So they're not able to take, in some sense, it feels like their thinking part of the brain in the front gets disconnected from the emotional system, the limbic system, your emotional system in the back. So you're not able to reason with that person. So when your family member who has mold toxicity is panicked, you may look around like there's absolutely no reason to panic, and they may even agree, yes, but I'm still panicked. So you're not going to be able to get the brain, different parts of the brain to talk. So they're not as able to think like a human with that. And then that affects relationships. We talked about family members, spouses, friends, and so forth. Relationships become more difficult when people are like, oh, I don't know what to say. I'm afraid I'm going to get them upset. They're not really making sense. Things look fine, but they're scared, they're depressed, they're anxious, they're in fight or flight mode, their heart rate is racing, their pupils are dilated. Well, that's the mold. That's the mold talking, and that can get better. We can treat those things, which in the long term, it's getting rid of those toxins. However, we also have therapies that can turn that down, whether it's supplemental therapies. Sometimes it's avoiding certain foods that are more likely to trigger those things. Sometimes it's looking at other neural retraining type therapies. There are several different ways to do that, from self classes to neurofeedback training that we'll be starting to do soon here at the office, or there's some referrals that we can make out for local or even distance where patients can get some help with getting through PTSD, which is one of the factors that can happen with mold, just because you feel like it's almost chasing you, which is another aspect. But you feel like you're not quite as human, you're not able to relate, you're not able to think, you're not able to remember, you're not able to reason as well, you're not able to feel things like other people seem to be able to feel. You lose sleep, so then things build up over and over. So mold's effect on mental health can be very debilitating. And ultimately, that can even get in the way of treatment. So if somebody's depressed and they don't think anything's going to help them because they don't have dopamine, they have low serotonin, it's hard for them to say, oh, I'm going to take those supplements that Dr. Potter or Hans has said are going to help, and they get stuck in that. Or they're anxious and I have a reaction to all these different foods. If I take this supplement, what if I break out? Or what if I have an upset stomach? Or what if I throw up? What if I get a fever? There's a lot of fear. So it makes some of those emotional things we have to deal with, and that's kind of what we do here. It's not necessarily, some patients can go straight into therapy, the emotions are not as big a deal. Sometimes we have to deal with the emotions before we can dig into therapy as much, or at least the detox root cause therapy. So we do that. Sometimes it's A, B, C, sometimes it's A, C, D, then B. Whatever we need to do, we're going to personalize that for the patient sitting in front of us to make sure that they're getting exactly what they need. So with that, how do you deal? How do you help someone that's facing this? One, you get to someone who, like us or other providers who understand that mold toxicity, mold poisoning, there are such things as black mold. All those things exist. They're not unicorns. They're not the abominable snowman. They are real. You'll have many doctors who say, somebody today my doctor told me that's impossible. It is possible. I see it all the time. Our family has lived through that, and I've seen the difference when people get out of that mold or get away from Lyme and treat that Lyme, that patients' lives do change. So it is real. So number one, find somebody that can help you. Number two is having a support network around you that can help you. It's going to be hard. Treating mold or Lyme, either one, are difficult. There's a lot of therapies, and it takes a while, and it takes a lot of endurance. And having a place where supportive of the family members, so we try to help family members understand that, or employers, schools, and working with those to help people get the support they need until they're better, and then they go all of a sudden like, oh wow, this person is going back to normal. It was really mold, and Dr. Potter's not crazy. So with that, getting help, getting support, and then ultimately, if you do have a Christian faith, we do encourage people to pray. Prayer is important in this because you need to have a rock to hold on to when it feels like everything's shaky and crazy. And you will feel at times like mold is chasing you. If you are listening, you're one of our patients, or you're experiencing mold toxicity, you're going to feel like everywhere you turn, you're going to have mold coming after you. It's going to show up in different places. You're going to have episodes you're getting re-exposed again, and you're going to be like, can I just get away from this? You can, and that's why I do say pray. Pray for protection, and pray for deliverance, and pray for victory. So with that, we're going to shift over and do some questions. So that's been a pretty good amount of time there talking. I spend a lot of time talking about mold. I love educating about it. We are actually working on something so I don't have to talk as much, although I do like to explaining things and teaching, but teaching through a mold guide that we will be putting out here pretty soon on the internet, and also sharing with our patients that we're already taking care of. They'll help you walk through. You probably could have a few hundred pages of how to live the mold life, how to conquer it. We are starting with the basics, so that way it's a step at a time in the mold treatment world. But we are excited about that, so we can help people overcome this, as God and functional medicine has helped us overcome that in our own family. So with that, again, any questions? It's education. I can't give direct medical advice in a setting like this, but I'm glad to help people understand and get some answers. So I'm going to take some questions that we have. So these are a little bit more about mold in particular, but what is the best way to remove or keep mold out of the car? Notice that when we all start sneezing, it is because I spilled a lot, and I use vinegar to scrub the area. We get better. Could this be mold in my car? Am I doing enough? So thank you, Angie. So one of the things we've talked about before is you've got to find mold wherever it is and get away from it. Now, whether you're reacting to the toxicity is different than if you're just having mold allergies. Mold allergies are more to the spores or fragments of the mold itself, whereas the toxicity is the chemicals it produces that come up in the air. Now, both can be a problem, and you can technically have both, and you can even be infected by mold, which usually is in the immunocompromised, so HIV, newborn babies, or the elderly, or somebody on chemotherapy. However, just to get rid of mold, whether it's allergies or toxicity in vehicles, one, you do want to try to keep your vehicle in good shape. So if you're spilling food or leaving food under the seat, having that regularly cleaned yourself or taking that to a detailer. We do have a Nashville detailers that will come and do those kind of services. They will both clean out what's there, and they have a product called PureTech. That PureTech product can actually be diffused over a period of time throughout even the HVAC system, all into nooks and crannies of your car, and it leaves behind a residual that is ultraviolet light, hits it, it releases ions that then keeps killing both bacteria, spores, viruses, mold, all those other things. So that's one thing that you can do, and you can do that every 6 to 12 months. The company guarantees it for 6 months of sterilization, sanitization, whichever word you want to use. But there are, I learned about it from someone who is actually trying to test and seeing that the URME score that helps us measure mold in a location continues to go down even after 6 months. So it may have up to 12 months, but the company will say 6 is what they will say it works for. So with that, you can have those things. But even if you're doing that, you still need, if you drop a bunch of French fries under the seat, they didn't get sprayed with PureTech, so you do have to do ongoing maintenance, which is a big part that we'll talk about in the mold guide of helping. Is it's not just a one-time and mold is gone forever. It's keeping your radar up and doing little things that prevent it from coming back in your life. But with that, you do have to make sure that you're getting the HVAC system in your car cleaned out. And if you do, even if you have the PureTech product in there, you want to change the air filter just in case there's some moisture or mold has settled in there. So even if you kill it, if you're allergic to it, you may still, every time you turn that on, have some sensitivities and reactions. So I have an anonymous question that was just, how do you best support when it's back to school time? There may be exposures there. So this is a really difficult and really touchy question because when it comes right down to it, most school buildings are flat roof buildings that have a significant risk for having water damage because if you have a roof like this, water goes off a little easier. If you have a flat roof that's barely tilted to drain, there's going to be little puddles, and eventually you're going to have mold on the outside. Now, that's not a big deal. However, if that water finds one little crack to go in, then you have a ceiling in a room that has a little slow drip, doesn't take that much water, and you can have mold. Now, I've had some patients test school buildings and they be relatively clean and not a problem. I've had others that did have to either change rooms or they looked up and they saw in the ceiling tiles mold growing that they needed to get away from. So that is something that you have to work with them. The difficult thing is those school buildings have a lot of money that they would have to do major repairs. Unless it's a huge problem that multiple people get sick from, often it's hard. The best you might hope for is, to change rooms, to switch from, Miss Smith's class to Miss Jones's class, so that you're not in that room that may be sensitive. Especially if you go in, the child goes into that room, and I'm sick when I go into that room every day. I have symptoms. Then you may want to try to change rooms. Now, turns out it's more of a school building. Changing schools. Going to a different school, homeschooling, there are other options, and some have to even do temporary homeschool, even if they go back to school just because they're so sick at that time. So now, I mentioned the fact that if you find others that are having symptoms, sometimes you can, if there's a group, more likely something can get changed. If you find out, little Susie and Johnny and Jackie and Bill also are having some weird symptoms, and it all started after that water leak, you have a little better case. We do write letters for schools to say, whether testing or encouraging them to address a visible mold infestation. Occasionally they do that. Other time schools will say, no, everything's fine. We had our guys come in and test and there's no problem, which gets into, do they use an URME test or HERTME, or are they using some air sampling? They go in and hold up a little can for 5 minutes and then close it and, is there any mold there? Or, air sampling can be okay in the right circumstances. It will rarely pick up Stachybotrys, which is the black mold. It doesn't float up much. It's very sticky and heavier and wet, so it doesn't go up in the air. But they very least need to do some swab samples if there's visible mold and do a visual inspection, not just, let's set this little canister up and see what happens over even 24 hours. So schools can be easy or hard to work with, just like kind of same thing goes for employers, where I have some patients who end up just switching jobs because they keep getting sick in their workplace and they can only work from home so much. So it's difficult, and every situation is a little different, and working with your school to see if there's something that can be done. Question from Donna. So is urine mycotoxin testing necessary if you've been seeing visible mold in the residence? know a person has been exposed, and if it is necessary, can you explain why? So, urine mycotoxin testing. First, let's talk about the different ways that we diagnose a patient with mold toxicity. There's kind of two camps. One uses some reactive tests, meaning showing that your body is showing changes, whether it's a immune system, hormonal system, inflammation system, those kind of things. Or is it looking at urine to see if the toxins are coming out? We use the former, which is more of a Dr. Shoemaker approach, because some people can have some mold going through them, their body gets rid of it, it's going out the door, they're not sick, they have no symptoms, their lab tests, if we did them, are normal. However, there's others where they don't get rid of those toxins, they build up, their urine toxin looks okay, except they're showing reactive signs in the labs and symptoms. So we're not going to depend on a urine mycotoxin testing in the beginning. There are a few situations to determine whether if you're two potential locations that are exposed and they're different molds, one type of mold in one place, one in the other, sometimes we'll use the urine testing to determine, oh, yeah, your levels are coming more from this mold and not this one. There's sometimes when we are looking to whether or not we have felt like we have gotten the mold out. They're feeling better, but not completely. Sometimes we'll use those, but for the most part, we're not going to use that. So getting back to starting with that basics, then answering your question, if you're seeing visible mold, do you need to do those tests? Well, again, you could have 4 people in that house. 3 of them may be perfectly fine, but one person's sick. Now, sometimes we have families where everybody is sick. Still, we want to know, just because even those 4 people, we've got a few situations where this person's actually organic toxins, they're not reacting to mold, even though they're the child of the parents who are, they're actually toxic from something else. But the other 3 are. So the detox, the therapy is going to be different for that one versus the others. So we want to know, is the person really reacting? 2, we would still have them do a test to identify. Sometimes that is mildew, which is not a bad thing. It's not, you can be allergic to it, but it doesn't have the same toxic effects. Or it could just be some stains that really aren't mold at all. So we don't want someone to go through, thousands of dollars of remediation, or, hundreds to a few $1,000s worth of therapy, medical therapy, if it's really not mold that they're seeing up there on their ceiling. So we do encourage patients to spend the money on those tests to be sure, because again, we don't want to blame mold if it's really hypothyroid, or we don't want to blame mold if it's yeast and they're not reacting, or blame mold when it's really Lyme. The therapies overlap somewhat, but ultimately you need to do more killing Lyme therapy. And if you never got to that because you think it's just all mold, the patient's not going to be getting completely better. So we want them to be sure before we put somebody through that work to clean their house or clean their body up. Another question, where do I begin to deal with mold in my house? Are all mold test kits created equal, or is there a particular one I need? So let's answer that. There's a few parts to this. Mold tests are not created equal. You can go and you can find a $5, $10, $20 one at a big box store. There's a number of those out there. You can set it out, little plates, and you can say, oh, we see a few colonies growing. You don't know which ones. It could be ones that have no toxins. It could be a bacteria. You really don't get a sense for how, now, if that whole plate's covered, maybe that's a bigger deal. It's not that we never have patients use plates, but that is not how we're going to determine what we do for them or what we tell them to do with their house. So we discourage those. We like the URMI or the HERTS-Me2, which are tests that actually look at what types of mold are there and the relative amounts. There are times when doing swab tests, if you have one area that you're really concerned about, or doing air test to kind of look at how things are blowing through your house. Not terrible tests. It's like any other tool that's a measurement tool. Is using different tools can give you different angles on the same issue. But the URMI and HERTS-Me are very nice because we have a good set of comparisons, objective data that we know for a patient they should be below, below this number on that test. So the URMI and the HERTS-Me that you can buy, EnviroBaromics or Assured Biomics, I think is the other one. if you're a patient, we can give you that information. But basically, you can order those online. Yes, they're more expensive, but they really are going to tell you whether there's an issue there or not. Further question, we live in an older home with a cellar-type basement, leaks as well as seeing signs of mold in bathroom walls, closet. What should I do first? One, again, test. So if you see your Hertz-me is a 28, you know there's a significant problem. Oh, you see it's only a 10, a little bit of a problem and not as big. You see it's a 40 or 50, yes, you might consider, I don't cut those numbers off, I'm just pulling them out of thin air for the moment, but one of those higher numbers on the Hertz-me score might say, oh, or especially if it's Stachybotrys or Aspergillus, you might say, yeah, let's, I had somebody had 100,000 on their Aspergillus. It's like, yeah, you need to get out of there as soon as possible in the next, couple of days. Find a temporary place until that can get cleaned up. But which of those locations, if you've got 3 fires in your house, which one's first? Ultimately, you need to put all 3 out. So it's whichever one you can get to first and throw the bucket of water on. With mold, obviously, you're not want to throw water on it. That doesn't help. But you're wanting to throw something at it, whether it's remediation to remove things, whether it's cleaning chemicals that are not going to make things worse, like don't use bleach, bad idea. Maybe some other time we can talk about that, but don't use bleach. There are things you can do to contain that or even just cover it up until you can get it cleaned. So having a professional remediator, just like having a doctor, a healthcare provider guide you through the medical side, having a remediator that's comfortable dealing with those chemically sensitive patients, mold sensitive patients, can help you make those decisions. It is worth the money if you get that professional help. Someone suggested Serpro. In other words, I'm convinced we have a mold problem, but how do I treat it without breaking the bank and doing it effectively, accurately? So the one you mentioned is not one I would necessarily choose. They're not going to, in general, they don't recognize the how far mold toxic patients need to go. Now, if you're just having allergies, Serpro might be enough. They're going to come in, clean things up, dry it out, have somebody seal things off. They may do okay if you're just allergic. If you're really having toxicity, I would look at other companies. There are some out there. Each one have their pros and cons, and some are better. Usually have 2 or 3 come out and look. Sometimes one will find something that the other one didn't. Also, you get to hear some different options to know, oh, hey, this one will let us stage things out, and maybe we do this part, and then we come back and do the second part in a month. That's a possibility. But whoever you call, I do recommend having a professional. If what you described, 2 or 3 different issues, you need to have a professional that can help you with that. But yes, the therapy is not cheap, but the remediation sometimes cost. People that have had water leaks, they found they were going on in huge amounts of mold. That water leaks may have been going on for months or even years. May have tens of thousands of dollars either out of their pocket, or sometimes, especially if it's a construction issue or a storm damage or something, they may get insurance to cover that. So do make sure that you're walking through that. If it's just some moisture, often insurance doesn't cover that. But it is hard. Again, the remediation of the house sometimes is often more expensive than what our therapy costs. So we get it. It does add up, but we also know the cost of being sick for years, missing work, missing time with your children, missing time with your family, missing activities. That's a very costly thing to lose out on. So we want to tell people what they need to do to get better. So I think Stephen is writing a question out here for me. And as soon as he's done.
You want to do number 1 and I'll
Yes. So there is much debate on whether to start binders detox while still in the exposure. What's your take on this, particularly with someone who is really struggling health-wise, little support and family and financially limited? From Diane. So if, again, I talked about 2 camps. When you're talking about binders, there's the camp who is, cholestyramine, that's it. Nothing else is worth taking. You're wasting everything else. The other camp uses a mix, including cholestyramine, but also looks at charcoal and clay, some other natural binders, especially glutathione. There's some fibers, glucomanins. So we tend more in that camp where we are, yes, you should start you should get your environment clean. And we do that. We have patients, that's what we require before we write a prescription for cholestyramine, which is a binder. We want them to be in a safe place. But while we're waiting for that, we can take the edge off and slowly start some of those toxins coming out with things like charcoal and clay or glutathione. So we will do that with a goal after a few months transitioning to do this cholestyramine as well. The other reason is those charcoal, clay, other binders sometimes get some other toxins. Cholestyramine does a great job, but it may not get all of those toxins. So if you do 2 different therapies, it's going to cover a lot more different varieties of toxins. And again, most patients can tolerate the charcoal and clay, whereas sometimes if you start cholestyramine and somebody has a bad reaction, it's actually because they're still being exposed. So we will always wait. So that debate is both a little difference in approach, but there are definitely good studies that show those other binders work, especially in the agricultural world for pigs, cows. There's a big problem with mycotoxins, mold toxins in animal feed. So looking for a lot of ways, and when you give those animals that, when they're getting those mycotoxins, you see them coming out, more of the toxins out in their stool and their urine. So it does work. And we do see patients get better a little faster. I call it the 20-mile-per-hour detox. Cholestyramine more the 50 to 60-mile-per-hour detox. We eventually want to go faster, but if you're starting up a stalled car, you don't need to slam on the gas and cause the car to wreck. So we use those slower, gentler, kinder, safer approaches until someone's in a safe home environment. We'll get another question from Stephen. So, can you see fluctuations in your mood based on each mold exposure? Then it subsides over a week when you treat with high-dose glutathione and ALA, which is alpha lipoic acid. Seems when I take a mold hit, I get very depressed. Then as time goes by, I get back to normal. So thank you, Jackie. So yes. So again, well, I haven't necessarily said this today, but I've said it before, is every mold patient is a little different, or sometimes a lot different than every other mold patient. If you've seen one, you've seen one. What happens is everybody responds differently, but we do have patterns. So there are a number of people who do have a lot of mold, mental health, emotional symptoms. Maybe the primary trigger that they know, oh, I've been exposed to mold. Other people can be exposed to mold and they just kind of drift down, and they never, there's not a, oh, I had big symptoms, I really fell off the cliff, to know that it was mold exposure in the building or a car or whatever it is. Others will be like, oh yeah, I can tell within 5 or 10 minutes I'm having symptoms, and yes, they can be depressed or more anxious. Can trigger the limbic system, which again is fight or flight, and then be just revved up for hours or even a few days before they settle down, and sometimes they get revved up and then have a crash for a few days to a week afterwards. So yes, you can have those kind of emotional responses that last for a number of days afterwards. The glutathione is one of the things we often, one of the reasons I like it is if somebody has an accidental exposure, they can take an extra few doses, and they can often see that the duration and severity of those exposure events is lessened by taking that glutathione. Another question. We've had the ERMI test based on your recommendation. Test found there was significant mold in our home. Do not have a reliable recommendation for a company to come out and find where the mold is. Where we don't necessarily have them in every location, and we've had some good and bad experiences with different companies. So we're trying to work with a little better guide to enable remediation companies to do a little better. Do you have a recommendation now? So what I would tell you to ask me directly, as far as we are not putting out specific names in a public setting, but we can answer that on the portal messages. We do have a portal system where patients can ask us specific questions. Do that there. They did have an inspector come out and we cannot find any mold. What are we supposed to do? So in that case, we do have people look for other locations, whether it's cars, school, workplaces. However, on the other hand, sometimes it's, oh, can't find any right now. Then we step back and think, are there other biotoxins? Are there other things like bacterial toxins? Lyme disease again, has someone been exposed to red tide or toxic algae in fresh water? Or is it something that was 1 year, 5 years, 10 years ago, and those toxins are trapped in that person and can't get out and are still causing problems. And we do have a number of patients where we're pretty sure we know the moldy house they were in, and they moved out, and they continue to be sick months and even years later until they do something like a detox protocol that does get those toxins out. So I would encourage you to send us a message, or the next, if we have an upcoming visit, we need to sit down and work through what are those other possibilities. Or is it maybe that this was a past exposure, that you are in a safe place, and we can proceed, like I said, with a 60-mile-per-hour detox now. So a question about whether or not I'd already discussed how mold affects mental health. Go back to the beginning. If you missed about the first 15 or 20 minutes or so, we talked about the different mechanisms by which mold, and this is actually a good thing to end on, we're nearing the end, is mold affects mental health through directly in the nervous system, which I don't know if I mentioned energy cycle. If you have less energy provided to your brain, it's going to have some changes, anxiety or depression. The other thing is whether or not through your hormones, through your immune system, inflammation, through your gut. I know I didn't mention is if your gut has a leaky gut or not absorbing well and you're not getting enough vitamins, your brain won't work as well. So you can have vitamin deficiencies, especially fat-soluble vitamins can cause some symptoms like low vitamin D, which mold also affects. So there's a number of ways. That is really a short explanation from what I talked about at the first, so I'd encourage you to go back there. And again, if you are a patient, you can ask us some more questions. And again, there will be a mold guide. Actually, there's a significant section about how a lot of the things we've talked about how mold can affect mental health in all your body systems is going to be included in that mold guide with our new upcoming mold website. So come back hopefully in the next 1 to 3 weeks. That will be all wrapped up. And if you're a patient, you can probably will be getting that from us in the next week or two, whereas the website may take 2 or 3 weeks to get that fully. Everything takes longer when it comes to the internet. It seems instantaneous, but it actually takes a good bit of work to get those things together. So I appreciate everybody's joining me today. I hope this was helpful. Again, you can send us, if you're a patient, send us questions. If you're not and would like to know more, Stephen, 615-815-5941, can answer a little bit more about how the general approach, obviously not clinical questions, he's not a clinician, but how you might be able to get some help from us if you think mold toxicity, mold poisoning might be contributing to an illness, or we're going to find out for you or a loved one. So I enjoyed sharing all that with you today. I look forward to next month. Don't remember if we've even set exactly what we're doing for next month, but that announcement will be coming out. And I will try to tell you that it is looks like September 12th. We will be doing another Facebook Live, so I look forward to seeing you then. Till then, blessings, and enjoy the what's left of summer.